Good afternoon, everyone. I am Dr. Amruta Ekbote, Assistant Professor in Surgery Institute College of Physiotherapy. I welcome you all to the part 4 of this Physio-TV classroom session, which is assessment of coordination. In the last lecture, we had seen a little preview or an introduction to coordination, as well as how coordination is managed or controlled by the various parts of the brain. Okay. In this session, we are going to see how we can check for coordination using different types of tests. So at the end of the session, the student or the viewer should be able to demonstrate non-equilibrium test, demonstrate equilibrium test, as well as name the test used for testing upper limb coordination, which we will see in the succeeding slides. All right. So there are two divisions or two subdivisions of coordination tests that have been traditionally used, which is the non-equilibrium test and the equilibrium test. So the non-equilibrium tests are most commonly going to assess your coordination in the sense that it is more related to assessing the interlimb, intralimb, as well as the visual motor coordination, whereas equilibrium tests are more primarily they check for not only your coordination but also some aspect of balance, because equilibrium tests are going to be in standing and with changing of the base of support as well as the center of mass. Now, non-equilibrium, first we'll see non-equilibrium tests. These tests addresses components of limb movements. Okay, so it is going to be test, non-equilibrium test is going to assess coordination of or movement component of the limbs, which is your upper limb as well as the lower limb. It also focuses on movement capabilities in several main areas, which is alternate or reciprocal motion. So coordination between right and the left side. Movement composition in the sense that in what sequence the movement is being carried out. Then movement accuracy, whether the sequence in which the movement should be carried out is the same sequence that a movement has already been carried out or not. And fixation or limb holding, that is the proximal part or the more of the proximal part able to maintain the starting position so as the distal part moves easily. So these are the few non-equilibrium tests and the videos in the succeeding slides. So first is your finger to nose, then finger to therapist finger, a finger to these all of these non-equilibrium tests can be assessed in different ways. So let's see videos for each of it one by one. So in the first video, as you can see, first video is for finger to nose. So here the starting position of the subject is going to be in sitting position. For most of the coordination tests, the starting position is going to be sitting unless you are changing the position and the patient is not able to come into a sitting position. So patient position is high sitting or sitting position. Then the shoulder is abducted to 90 degree, elbow is extended, and the index finger is pointing towards the out and pointing towards the opposite side. Okay. Now you have to instruct the patient, you have to instruct the subject that you have to bend through the elbow and touch the nose. Okay. As you can see here, let's play it from the beginning. Okay. So here the instruction should be very specific because you want the subject to touch the tip of the index finger to the tip of the nose. Okay, it is not going to be just the pad of the index finger, but the tip, because touching the tip to the tip of the nose is a little difficult movement. Okay, now you can once the subject is able to do it with one hand, you can go for bilateral simultaneously, bilateral upper limb simultaneously. You can check for both. Yeah. So first right, then left. Okay. Now to challenge the patient, to challenge the subject, what you can do is ask the subject to do the movement fast and then check for the accuracy. Okay. Accuracy of the movement. So any coordination movement are going to be checked or graded according to these four characteristics, which is whether or not the patient is able to do alternate or reciprocal motion, how is the movement composition, what is the accuracy of the movement, is the movement smooth or not, is it jerky, is the patient able to touch the tip to the tip of the nose or not, and whether he or she is able to maintain the proximal joint in like fixate the proximal joint for so that the distal moves accurately. Okay. Next is your finger to finger. So here also the patient position is going to be sitting, and starting position is going to be abducted, both hands, shoulder abducted to 90 degrees, elbow extended. Now here you have to instruct the patient that by bending the elbows, the subject has to touch the tip of the index finger, index finger of one hand to the tip of the index finger of the other. Here you can challenge the subject by asking the subject to increase the speed of the motion. Next is your finger to therapist finger. In this video, okay, the patient position is again sitting and the therapist stands either at the side or in front of the subject, and you have to instruct the subject that he or she has to touch the tip of his index finger to the tip of the therapist's index finger. Here you can challenge the patient by increasing the speed and altering the direction and checking whether the subject is able to do it accurately or not. Okay. Next test is your alternate nose to finger test. In this, alternate nose to therapist finger test. In this, again, standing position is sitting. You have to instruct the patient that he or she is supposed to touch the tip of the index finger to the tip of the nose, to tip of his nose first, and then to the tip of the therapist's index finger. Here, the therapist can challenge the patient by altering the speed and direction of the movement. Make sure that each time that you check for the non-equilibrium test, that the patient is able to go into the starting position first and is completing the movement. So sometimes what happens is the subject might not completely touch the tip of your finger, okay, and then just like a phantom touch, and then he or she will take the hand back. Okay, so make sure that whenever you are checking, that you instruct the subject that you have to touch the whatever target is given to you. Okay, next is your finger opposition test. So here again the patient position is sitting. You have to instruct the patient, instruct the subject that he or she has to touch the thumb to all the fingers. Okay. Now here you can ask initially to touch the thumb pad and then go for thumb tip, touching all the other fingertips. Okay, so as you can see, opposition, and you can challenge the patient, challenge the subject by asking the subject to increase the speed of the movement. Next test is mass grasp. Okay. So here in mass grasp, you have to ask the subject to flex and extend the fingers. Okay, like imagining that the patient is trying to grasp an object. Okay, here you can challenge the patient by increasing the speed, asking the subject to do both the hands simultaneously, and then or both the hands alternately. So as you can see, she's doing fast, then simultaneously both the hands, and alternately both the hands. Okay. Next is your pronation and supination. In this, the subject is asked, the starting position is going to be shoulder at neutral, and elbow should be 90 degrees flexed, with starting position should be either mid-prone or even in pronation, which is fine. Okay. And now you have to ask the subject to do pronation and supination. So check whether the patient is completing the movement or not. Okay. Then challenge the patient by asking by telling the patient to do both the hands simultaneously, and then further, if you want to challenge, then you can ask the subject to do both the hands alternately while increasing the speed. Now she's doing both the hands simultaneously, and now she's doing alternately. So in this, you can ask the subject to change the speed. Okay. Next is your rebound phenomena. Here in rebound phenomena, the starting position is sitting and elbow is flexed to 90 degree. The therapist is going to apply resistance to the motion of elbow flexion, and isometrically the resistance should be applied, and suddenly the resistance is removed, but the subject should be able to maintain it in elbow flexion. Okay. Okay. Next is tapping of the hands. Now here the patient position is again sitting, and elbow is flexed to 90 degree, so that the hand is resting on the thigh of the patient. Okay. Now here you have to ask the patient to tap on the thigh. Okay. The movement should be more from the wrist. To challenge the patient, you can ask to challenge the subject, you can ask the subject to do it simultaneously with both hands, and then alternately with both hands while changing the speed. Okay, in a similar way, for tapping of the feet, the patient is sitting on a chair with the legs placed firmly on the ground. Okay, so until now the preferable position was high sitting, but for this test, the subject needs to sit on a chair appropriate height, wherein the feet are firmly placed on the ground. Okay, now ask the subject to tap the ball of the foot on the ground. Okay, the motion should be from the ankle joint. Okay, challenge the subject by asking him to do it simultaneously or alternately while altering the speed of the movement. Next is pointing, pass pointing. So for pointing, pass pointing, the therapist and the subject is going to sit opposite to each other with shoulders 90 degree flexed and elbows extended, with index finger pointing towards one another. Okay. In the beginning of the test, the tip of the index fingers of both the parties, that is the therapist as well as the subject, should touch each other. Okay. Now you're going to instruct the subject that you have to take your shoulder completely into flexion, shoulder flexion, and then come down and approximate the index fingers with my index fingers. Okay, so whenever the patient comes down, he or she should be able to touch the index finger, tip of his index finger to the tip of my index finger. Make sure that the therapist or the position of the fingers is not altered. Now here again you can do it. Yeah. So here again you can do it simultaneously for both the upper limbs, or you can ask the subject to do it alternately while altering the speed of the movement. Okay. Now here you can one other thing that you can do is, instead of telling the subject to take full into flexion, you can ask the subject to go into neutral as well. Okay, and then come again to the to 90 degree, from 0 to 90 degree. So here make sure that that the subject is touching the tip of the index finger to the tip of your index finger. If this is affected, then the subject is going to move past the index finger. He or she won't be able to approximate it at the initial position. Okay, so these were the tests for, like, non-equilibrium tests for upper limb. Now there are few more for lower limb. So first is your alternate heel to knee and heel to toe. Okay, for this the starting position is going to be supine line. Okay, now you have to instruct the subject that he or she has to touch the heel of one leg to the knee of the opposite leg, and then to the toe of the same leg that he was touching for the knee. Here you can alter the speed and challenge the subject more. Make sure that the movement is smooth, it is accurate, and the subject is able to touch the knee and the toe appropriately. Okay. Next non-equilibrium test is your heel on shin. So here again the subject or the patient position is going to be supine, or this can be done in the sitting position as well. Instruction to the patient is you have to drag the heel of one leg on the shin of the other from up to down. Okay, let's see the video. There you go. Okay, here you have to check whether the movement is smooth or not, and you can challenge the patient by further altering the speed. All right. Next test is asking the subject to draw a circle in the air. So check whether the subject is able to draw a circle with his or her leg or not. The last non-equilibrium test is touching the toe to therapist finger. Okay. In this also the patient or the subject is supine lying. Make sure that you give a pillow under the head of the subject so that he or she is able to easily visualize the tip of your finger. Now instruct the subject that he or she has to lift the leg and touch the tip of the great toe to the tip of the therapist's index finger. Here you can challenge the subject by altering the direction of the movement, direction of the target, and changing the speed. So yeah, so subjectively, if you are going to grade coordination, then you can speak in terms of whether the movement was smooth, whether the subject was able to do it alternately, simultaneously, or individually, and whether the distance that was supposed to be covered was accurate or not. Okay, and whether there was fixation of the proximal limb or not. Okay. All of these tests can be done first with eyes open and then with eyes closed, so that further you challenge the patient by minimizing your visual input. Okay. All the non-equilibrium tests in a clinical setting are very easy to administer, and you can choose which test do you want to do for the subject. Accordingly, you can choose the test. It is not necessary to do all the tests at the same time, but you can choose 1 or 2 tests to be done and accordingly grade the movement. Okay, moving on to the equilibrium test. So, equilibrium test, what are we going to check is the ability to maintain the body in equilibrium with gravity, both statically and dynamically. Okay, so let's see the tests that can be done for equilibrium one by one. So these are some of the tests that can be done for checking equilibrium. Many of which can be like they are divided into static and dynamic. So walking and perturbations can be considered this dynamic, whereas few of the others are going to be static. So let's see how these tests are done. I've not included all of the videos because standing comfortably with the normal base of support, all of us know how to stand with a normal base of support, what instruction you have to give to the patient. Make sure that whenever you're checking for equilibrium test, you're going to grade the coordination test accordingly. Like for non-equilibrium, how we were checking for smoothness or accuracy and speed of the movement. Similarly, for the equilibrium test, you are going to check whether there is increased sway, whether the patient is able to maintain the posture for a certain amount of time, or whether the subject is losing the balance. Okay. So in the first video, so I've instructed the subject to stand with narrow base of support. Okay, you can ask the subject to maintain this posture for a minimum of 30 seconds. Then once he is able to do this, you can challenge the patient further and check for this position in tandem standing, whether the subject is able to maintain tandem standing or not. So again, we are narrowing the base of support here, narrow base of support. Now tandem standing. Tandem standing is what? Placing the heel of one leg, like standing in such a way that the heel of one leg touches the great toe of the other. Okay, and then further, if you want to challenge, then you can ask the subject to stand on one leg. Okay, now here both of the limbs have to be checked. Okay, next is your trunk lateral flexion. See whether the subject is able to do the flexion without losing the balance. Okay, and instruct the patient to stand with a normal base of support. Okay, next test is your forward reach test. Here, first of all, ask the patient to stand comfortably and with shoulders 90-degree flexed and elbow extended, as you can see in the video. And you have to instruct the patient to reach forward. Okay, how? With trunk flexion. Okay, make sure that he or she is moving only from the trunk and not stepping forward. Here also check how much distance the subject is able to cover, and check whether he or she is able to do it without losing the balance and without changing the base of support as well. Okay, next is now these were the few tests which can be done for standing and checking a little bit of static balance in this same position, that is standing with normal base of support, then narrow base of support. You can check for dynamic balance by giving perturbations and see whether the subject is able to maintain the balance, maintain the COG in the base of support or not. Okay. Next is for all of the next components are for walking. Okay, so starting with sideways walking, ask the patient to stand comfortably first on a floor and mark a straight line on the floor. Now, at the beginning of the line, ask the patient to stand at the beginning of the line and move sideways, okay, on the line itself. So he or she has to walk on the straight line that is marked on the floor, as you can see in the video. Okay, check whether the subject is able to maintain his feet on the line or not, if he is able to walk sideways in a straight line or not. Before going for sideways walking, you can ask the subject to walk in a straight line on the line that is marked on the floor. Then in the same manner, you can ask if he or she is able to walk in a straight line, you can go for tandem walking. You can go for tandem walking, you can go for cross stepping. So here in this video, it is cross stepping, and see whether the subject is able to maintain the posture throughout or not. Then once you're done with sideways walking, you can go for backward walking. Here also the backward walking is going to be on the line marked on the floor. Okay. Now, once the subject is able to do these, okay. So now once the subject is able to do these, you can narrow the base of support by asking the subject to walk on heels or toes, like in this video. So here also make sure that he or she is walking in a straight line and is able to maintain the posture throughout, is not losing the balance and falling. Okay, in the same way, you can challenge the patient by increasing the speed, altering the direction, asking the patient to turn in between the movement, okay, in any direction. You can ask the patient to turn 90 degrees or 180 degrees or 360 degrees, take a complete turn and then walk again. So this is how you challenge in the test which involves walking. Okay. Next, you can ask the subject to march in place and see whether he or she is able to complete the motion and maintain the posture. Here you can challenge the patient by asking the subject to alter the speed of the movement. Now, in the next test, you can tell the subject to do another task while walking. So in this video, I have used vertical and horizontal head turns, okay, which is called this whole thing is called dual task, right? So you have to ask the patient to walk in a straight line, right, and do vertical and horizontal head turns on command. So standing near to the patient, you have to instruct or ask the patient to change the vertical or horizontal this on like whenever you instruct. Right? Then ask the patient to pivot. Now she's doing vertical. Again, pivot, turn around, and do horizontal. Okay. First, initially, you can ask the subject to walk with horizontal head turns, then go for vertical, and then challenge the patient by telling him to change the movement on command. Next is your walking in a circle. Walking in a circle, count like clockwise and anti-clockwise. Both make sure that you make the patient do both. This will tell you whether the subject loses balance on pivoting or not. So walking in a circle, once he or she is able to like do this, you can decrease the size of the circle and then um, ask the subject to walk in a circle again. And you can also challenge by telling the subject to increase the speed. All right. So subjectively, I told you how you can grade all of these movements, or how you can comment whether coordination is present or coordination is impaired. But quantitatively, how are we going to grade the equilibrium as well as the non-equilibrium test? So for non-equilibrium test, the grades are from 0 to 4, wherein 0 is activity impossible. Now here, there can be many reasons why the activity is impossible. Maybe the subject is not able to maintain the starting position or even attain the starting position. In such cases, you cannot check for that particular test in that particular patient. Then severe impairment. Severe impairment here, the patient is able to do the movement, okay, but it is so jerky that he is not able to complete it. Okay, then there is grade 2, which is moderate impairment, then grade 3, minimal impairment, wherein minimal impairment is where it is going to be like slight difference from the normal movement. So in cases of stroke, if you're checking for coordination, what you can do is go for tests which will give you like appropriate test which will predict whether coordination is affected or not, and check first on the normal side and then on the affected side. Then and grade 4 is normal performance, wherein the patient is able to do all the like attain the position also, complete the movement also, and do it according to the instructions given. For equilibrium tests, again, the grades are from 0 to 4, wherein 0 is absent, 1 is poor, 2 is fair, 3 is good, and 4 is normal. So in normal, the patient is able to stand, not losing balance. In good, maybe he requires some sort of assistance for good and fair. Poor is where if you decrease the base of support, as soon as you decrease the base of the support, he or she is going to lose the balance. And 0 is absent, wherein there is he cannot perform the equilibrium tests. Now, all of these tests can be used for upper limb as well as lower limb, as we saw, but there are few tests wherein all of these components are checked, like interlimb coordination, intralimb coordination, as well as eye-hand coordination, which are specifically designed for upper limb. Okay, so let's see those tests one by one. So for upper extremity coordination, first is your Jepson hand function test. As you can see in the picture, so there are various like instruments or tools from our day-to-day this which can be used. So herein there are 7 tasks where the subject has to fulfill all those tasks according to the instructions given, and it requires coordinated movement of the hand and the fingers. So it is not just what do you say? It is testing the coordination of not just the distal part but also the proximal part. So in a movement sequence. So what are the common items used for Jepson hand function test is spoons, paper clips, cans, and pencil. It also will check for your eye-hand coordination because that is required for doing all of the tasks in this test. Next is your Minnesota manual dexterity test. So here it consists of 2 operations, which is placing and turning. So the peg here, as you can see, okay, you have to ask the subject to lift it from some other side and place it in the bowl, in this bowl. So the size of the peg and the holes is going to vary, right? And the direction in which it can be placed will also vary. So it is not just that you have to, lift and place it into the bowl. but you have to lift, like judge whether which hole the peg is going to fit, and then place it accordingly. Because if it does not get placed in the appropriate hole, then you will have to manipulate in the hand itself and then place it on the board here. Okay. All of these tests, they have a particular scoring system. So according to that, you have to score the test, and interpretation is given. So you can work once you understand which component is affected, you can work on improving or retraining that component for that particular patient. Next is your Purdue pegboard test. Here there are 4 types of different like tools that you can use, and it also has different size. Okay, so there are pins, collars, and washers that are used, and you have to lift from the from where it is placed, and place it in the hole here on either sides. Okay, so the scoring is based on number of assemblies completed within a 30-second or a 60-second period. Okay, here very small pegboards and very thin pins can be used to challenge the patient. So here, as you can see, fine coordination, like using your thumb and your index finger will be appropriate. So lifting, it is not just that you have to lift and place, right? You have to lift, judge for the appropriate size, and then place it. If it does not, you have to manipulate accordingly, and then make sure that the appropriate pin goes in the appropriate appropriate size hole. Okay, scoring will be done as like how many the subject is able to put in the hole in a 30-second or a 1-minute time period. Thank you. I would also like to thank Dr. Parag Singh Jeti sir, our chairman, and Mahesh Sangvi ma'am for their constant guidance and support. I would like to thank Dr. Apurva Shimpi sir, principal of Sancheti Institute College of Physiotherapy, for giving me this opportunity. Also our technical team, without them this session would not have gone as smoothly as it has. And lastly, to all the viewers for religiously watching all of these videos that we record. Thank you so much.